Hello, welcome to my channel. I'm Dr. Naeem. Today's topic is extremely important disease, heart attack. I'll cover what it is, heart attack, heart anatomy, signs, symptoms, emergency steps including what to do if someone collapses, medical treatment, and home remedies. Let's get started. Anatomy and physiology of the heart. The human heart is a powerful muscular organ located slightly to the left side in the chest. Heart has 4 chambers: right atrium, right ventricle, left atrium, left ventricle. The left ventricle pumps oxygen-rich blood to the body through the aorta, while the right side handles oxygen-poor blood from the body to the lungs. The heart relies on coronary arteries for its own blood supply. When these arteries become narrowed or blocked, it leads to a heart attack, medically known as myocardial infarction. What is a heart attack? A heart attack occurs when the blood flow to part of the heart is blocked, usually by a clot. Without oxygen, the heart muscle begins to die. Prompt treatment can save heart muscle and life. Causes of a heart attack. Several factors increase the risk of heart attacks, such as coronary artery disease, plaque buildup in arteries. High cholesterol leads to fatty deposits in arteries. High blood pressure damages artery walls. Smoking damages arteries and reduces oxygen. Diabetes affects blood vessels and increases risk. Obesity puts strain on the heart. Lack of physical activity. Stress triggers heart rhythm changes. Family history of heart disease. In some cases, drug use like cocaine or severe emotional stress can trigger a heart attack even without artery blockage. Signs and symptoms. Common symptoms include chest pain or pressure, tightness, squeezing, fullness, pain in left arm, neck, jaw, or back, shortness of breath, sweating, cold sweat, nausea or vomiting, lightheadedness or fainting. Women may also feel extreme tiredness, indigestion, or jaw pain. The face and lips may turn bluish or pale. This condition called cyanosis. Silent heart attacks. No obvious pain may occur in diabetics and older adults. Emergency action. If someone shows signs of a heart attack, call emergency help. Ambulance immediately. Make the person sit or lie down calmly. If conscious, give aspirin 300 milligrams, chewed, unless allergic. If they collapse and stop breathing, start CPR if trained. New step: if patient collapses and is unresponsive, turn the patient's head to the left side to avoid choking. Elevate their legs using a pillow or bag. This helps improve blood flow to the brain. Loosen any tight clothing. Monitor blood pressure until medical help arrives. Treatment or management at hospital. ECG and cardiac enzymes are used to diagnose. Clot-busting drugs. Thrombolytics may be given. Angioplasty or stent placement opens blocked arteries. In some cases, bypass surgery is needed. long-term medications like beta blockers, ACE inhibitors, statins, and lifestyle changes. Home remedies and lifestyle after heart attack. Recovery involves strict heart care. Eat heart-healthy foods: oats, olive oil, nuts, fish, vegetables. Regular light exercise, walks daily after doctor's advice. Quit smoking and limit salt/alcohol intake. Reduce stress. Meditation, deep breathing, prayer. Control blood pressure, cholesterol and diabetes. Helpful home ingredients after doctor approval. Garlic, natural cholesterol reducer. Omega-3 supplements from fish oil. Turmeric milk, anti-inflammatory. Heart attacks can be life-threatening, but awareness and action can save lives. Early signs, timely treatment, and healthy living are your best defense. Thanks for watching. If you found this video helpful, please like, share, and subscribe. I'm Dr. Naeem, and I'll see you with more medical